Hello, I'm Dr. Beckham from All Seasons Integrative Health. And today I would just like to kind of cover the 7 areas that the office can help you with so that you can live a resilient life. So, first of all, we have, like the top of the logo you can see on the screen here is Reconnect. And there we're looking at trying to reconnect your nervous system. So from your brain and spinal cord down to your what is called your peripheral nervous system. So your muscles, your tendons, your ligaments, your joint capsules, your joint synovium, all the fascia, your skin, periosteum, your bones. You kind of get the point here. And making sure that also we're connecting it with your autonomic nervous system, which controls all of your internal organs. Both help speed them up and slows them down. This is what most chiropractic offices are covering here. They're getting your nervous system tuned up to make sure that it's functioning as optimal as possible. But this is just where we get started in the office. The next area here we have is, if I forward here, so there's Reconnect. The next one is Rehabilitate. And there we're looking at rehabilitating not only your functional parts of your body here, but also the structural parts of your body. Chiropractic care, a lot of times they're focused on some corrective care to help restore the appropriate alignment of the spine, as well as the motion or movement of the spine. Some of it could take a short bit of time. Some of it could take even longer, depending on what has kind of even brought you into the office in the first place. But we also utilize some computerized testing equipment in the office that looks at how you move. It looks at balance. It looks at your posture. This very comprehensive test. It's actually a functional movement screen, which is used by all of the professional sports teams in the United States to find out if their athletes have anything going on with them that could possibly get dealt with before they even get on the field, so that they don't injure themselves with something that could have been prevented. By doing this test here, we can kind of find out, even with some of the other clinical things that we're finding in the office here, to make sure getting you rehabilitated back as close to an optimal state as possible here. Also looking at just we want to look at your body basically from your feet on up through what's called your kinetic chain. We're going to make sure that all of your bones and joints are moving properly through your whole entire body, not just your spine. A lot of people end up having just kind of chronic neck problems, and yes, it might have been neurologically some stuff coming from the neck, but we need to also look at the musculoskeletal system here to make sure that we're getting that aligned properly here, so that that is as stable as it possibly can be, and you just don't have the continued stress on your nervous system, throwing that right back out again. So we're trying to make sure that not only is your nervous system, but your musculoskeletal system is functioning like it should and has the proper structure there, so that long term we can get your problem fixed and you don't have to keep going back to fairly reliable Bob's Chiropractic Clinic with the disappearing taillight guarantee. The next portion of what we can help you with here too is to regenerate. And that could be anywhere from like discs. We have patients that come into the office that have degenerative discs. And in those cases, depending on what phase it might be in here, we do have some therapy that can help even reverse the effects of the degenerative disc on your body by kind of reversing it about a whole phase in a matter of months of care, which that degeneration could have taken anywhere from 5 to 10 years to occur. So reversing the effects of that degeneration, like I say, that has possibly been there for 5 to 10 years, to get it done within a couple of months can make a big difference in your life. That can be helped by even some nutritional products as well. But again, depending on what each and individual person has going on, we're going to customize something that's going to fit well with you. We also have other therapies in the office that help out, like electric stim therapy, ultrasound therapies, laser therapies. Those are very effective. and just helping to restore the blood flow and all that to people's tissues that just aren't functioning really well. Helps decrease the pain as well. So the next phase here is recharge. As far as in the office, we do have some therapy that is called PEMF therapy. It's a therapy that basically helps to recharge your body. Your body is like a battery. It's going to get run down over time. Some people, it's going to happen more than others. People that have things like fibromyalgia, chronic fatigue syndrome, have patients that have Lyme's disease, myofascial trigger points, things that are just causing you to be fatigued and tired. By using PEMF therapy, this can help recharge your cells, get your blood flowing more appropriately here. There's been studies done by, there's a German company where they had PEMF therapy that they used, and within 15 minutes of running this on patients that were undergoing a surgery, you could see where their blood cells were kind of sticking together before they ran the therapy, which is called the rouleau effect. Not that you need to know that, but after they put a charge on the cells there within 15 minutes, all the cells have a charge on them so that they kind of can repel each other a little bit, and all of a sudden they can actually flow through the arterioles, which are the smallest vessels in your body that can only allow one blood cell through at a time. So again, patients that have things like neuropathy, patients that have even just cold extremities, some people with even Raynaud's can notice a difference with the therapy here too. The next portion after that we get into is Refuel. And we're focusing predominantly on looking at foods that you might actually be having kind of a sensitivity to. This is a blood test that would be done, and it's going to find out and give you basically a customized diet, because there's going to be food items, more than likely, maybe food additives, food colorings. It tests a bunch of different, even certain medications that people use on a regular basis, different molds and various different things like that. Gluten intolerance, lactose intolerance, dairy intolerance. Once you kind of know what your body is causing or having an immune response to, if you can remove those from your diet and just eat the things that you don't have an immune response to, you can have some significant improvement in your diet in your whole life, because now the foods that you're eating are actually building your body up and not causing it to have an immune response. So the next phase or portion is restore. This is actually looking at some blood tests. It'd be the same blood test that you're going to get done in a medical clinic. Instead of us looking at them like the medical facilities do, are you within the average range there? That can be quite wide at times. We're going to look at it more as, is it optimal? Are you in an optimal range here? If you're not in an optimal range, it's going to indicate that you might need certain vitamins, minerals, amino acids, essential fatty acids, changes in your diet. Maybe you need to rehydrate yourself. Any of those things that kind of come up, we can make sure that we are getting you exactly what you need, being very targeted with it, rather than just giving you a whole bunch of supplements and hoping that it's going to help your condition get better just based off of the symptoms that you have going on. If we just treated things off of symptoms, we're not going to probably get down to what's causing the problem and get the problem resolved for you. So by doing the blood labs, we can help you out and get you more specifically what you need so that your body can heal itself. Your body is made to do that. And if we can get you everything you need, you're going to be able to have that resilient life. The next area is rehydrate. Of the people that I've seen that have labs coming back, it's almost 50% of the people that literally are coming back that they're just dehydrated. They need to have more water in their diet. They need to drink more water. They need to have electrolytes in that water to help keep even that charge, going back to recharge, to make sure that their body can hold that in their body there. Otherwise, they're going to slowly kind of lose that. And, it just helps out by helping get your food through your body, get all the nutrients to your body. It can make a huge difference just by making sure that you get enough water in on a daily basis. So if you want to live a resilient life, you can, just contact us, and you can always come in for a complimentary consultation, or you can just come in and go through our initial process, and we can give you an idea of, can we help you? If we can help you, we'll let you know what we need to do to kind of find out what's going on with you. And then we can create a customized plan to help you live a resilient life. I hope that helps. And if you have any questions, please feel free to contact us, and we'll help you get on your way to living a resilient life. Thanks.